What's going on YouTube? It's your pal Drewski here again. I got a update video on George W. Bush's health condition. He does seem to be improving, so I'm going to give you the clip here from Fox News. Check it out.
Fox News alert, former President George Herbert Walker Bush hospitalized in the state of Texas.
His chief of staff says that he is doing just fine and he's expected to go home in a few days. But he has had several health scares these last few years, including breaking a bone in his neck last summer. Last summer, I guess he broke the bone in his neck. Was it last summer? Yeah.
Here to weigh in, who's been in touch with the team, is our A-team member, Dr. Mark Siegel. Dr. Siegel, should we be worried about Bush 41?
No, we shouldn't. From what I'm hearing, he was just admitted as a precaution on Saturday, Brian, because of shortness of breath. The same thing that happened in 2012, where he ended up having bronchitis. You see, when you have Parkinson's disease advanced like this, you may have trouble clearing secretions, and you may get bronchitis. But what I heard from his senior spokesperson this morning is he's responding very well to treatments, things like albuterol, things to clear secretions. He's awake, he's alert, he's chipper, he's responding. My own prediction from what I'm hearing is that he should be out of the hospital in a couple of days.
Wow,
I think this is good news.
Not being able to clear your throat. I mean, that's what you're saying, isn't it?
Because the secretions build up, so you need help, right? You need suctioning, you need treatments. Now, it's not always that way for him, but at times it gets like that. Well, it can be really difficult.
When you hear shortness of breath, you know, that could be a symptom of a lot of bad stuff, but given his history, you feel that that's what's going on.
Well, also, Steve, because you're immobile, you know, if you hear shortness of breath, you want to make sure, get someone in the hospital, make sure they don't have a blood clot, things like that. But by now, all of that would have been ruled out. So when he says that he's responding, that he's awake, that he's alert, that he's breathing better, that he's responding to the breathing treatments, I know that's a very good sign.
Well, we knew that he wasn't going to go to the inauguration for health reasons, but 43 and his wife were going to be there. I wonder if this is going to change things for them. I guess it depends on how good he's doing on Friday.
I heard he's doing very well, and I heard this morning that 43 is still expected to attend the inauguration. So nothing has changed, and my prediction would he would be out of the hospital. But, you know, look, when you're a former president of the United States and as well-loved as George H.W. Bush, you take every possible precaution. So he's there for a precaution, not because he's getting worse.
All right. Dr. Siegel, thanks so much.